Good morning, everyone. Welcome to Brush Up on Business presented by Oral Health Group, a special Brush Up podcast series focused on the business of dentistry. I'm Dr. Jordan Soll, Chairman of Oral Health's editorial board, and today I'm joined with Dr. Carlo Biasucci. Dr. Biasucci is a Canadian dentist, author, and practice consultant. He has founded Northern Dental Care in Sault Ste. Marie, Ontario in January of 2009 with the guiding philosophy of friends helping friends. To further his training, he completed the core curriculum at Las Vegas Institute for Advanced Dental Studies and has taken advanced courses in conscious sedation, implant dentistry, and orthodontics. In addition to clinical work, Dr. Biasucci is also a speaker, business educator, and consultant to other dentists. He is the founder and CEO of Elite Practice, a training and growth solutions organization serving dentists in Canada and the United States. He has authored multiple books and more than 200 articles covering dentistry and professional practice topics. Welcome, Dr. Biasucci.
Thanks for having me, Jordan.
Before we jump in, I think in the essence of transparency, I would like to also say that I am a client, a full freight paying client of Elite Practice. And it's just my being so impressed with the program that I invited Dr. Biasucci to do this video cast series with me.
Awesome. And please call me Carlo.
I will. Thank you.
Yeah. Wonderful. Wonderful to be here.
Okay. So before I let you speak, I want to take a page out of your latest book, Beyond Clinical Excellence, which excellent book. And I want to set the tone for what is happening in dentistry today. And you know, I kind of always say in my family, I'm ringing the bell on the Titanic. And I kind of feel when I read your book in the beginning, you're doing the same thing. You're trying to enlighten the dental profession and the dentists that really want to excel of what's happening and the challenges ahead of them. So I just want to start off by saying data from the American Dental Association shows a steady decline in the percentage of dentists who own their own practices. In 2005, approximately 66% of dentists were solo practitioners. By 2021, that number has now dropped to under 50%. Simultaneously, dental service organizations have doubled their market share, with projections indicating they will control over 50% of the U.S. dental market within the next decade. These numbers aren't just statistics, they reflect a seismic shift in the business of dentistry. With Canada, the shift of corporatization isn't as aggressive, but Canada usually follows the U.S. statistics within a decade. I could read more, but as Carlo goes on to talk about, it's also the shift in attitudes of the dental patient. So Carlo, I'm going to ask you, please elaborate, tell us where the dangers are.
So with solo practice, and this is something that I discovered early on, right? You know, there was a time, of course, when you could build it and they will come. I can open a practice, and just the fact that I am there and I do good work, people will come to me. That has changed. And the loyalty of patients has changed. The competitiveness of the market has changed. Basically, it has shifted dramatically in the last 20 years. Even in the last 10 years, if you look at the market in dentistry, the landscape has changed. So if I'm a solo practice, the typical practice that your average numbers are based on, one dentist and 4 or 5 employees, nothing wrong with that model. But in the competitive landscape that we have today, though, well, what happens where I'm now up against all the dentists up and down the road from me now have twice the marketing budget, twice the budget to spend on training, twice the budget to spend on hiring the best people. Now maybe twice the budget is an exaggeration, but they have it if they need it. And we've seen this trying to find a hygienist in today's market. Well, we might all be paying a competitive salary, but I can get a $10,000 signing bonus with this practice because they've got the backing to do it. And if that doesn't work out and they end up having to do that again in 3 months, well, they can do it. If I'm a typical practice owner, now my margins are being shrunk and shrunk and shrunk. And so I'm up against this wall, so to speak, of, can I continue on the path that I'm on? And every dentist is starting to see this. Their profit margins are shrinking. They're working just as hard, if not harder. And why am I stuck on this treadmill of trading dollars for hours? And if I want to continue even where I was, even if to make the same income today as I made last year, I've got to work harder. And so something is breaking within the industry for the average dentist. And this is, I think, what we're going to elaborate on today.
Okay, I'm going to go a little off cue for a moment. If there are no changes, if somebody doesn't course correct, tell me how you see this look in 5 to 10 years from now.
So the adaptable practices are the ones that will survive. The practices that think that everything is going to be the same and nothing's ever going to change, I would just point you to Blockbuster. I mean, eventually the thing that you're doing is going to be irrelevant, and you're going to end up getting swallowed up by the competition. Like everyone understands how that worked out, right? I mean, no, people are still going to keep coming to rent physical videos. Yeah, no, there's a point where they're not.
So you have to just, Einstein's famous quote, keep doing the same thing over and over again and expect a different outcome.
Exactly right. So the adaptability is the key for any business, but dental practice is no different. And truly, dental practice is a business. I know that we are in it's a service business. Our primary goal is to treat patients, to treat them well, but it's still a business at the end of the day. I think every dentist gets that. The key is, so what do I do to stay competitive? Because what we all typically do, so what I did when I first started, I took 1,000 hours of CE in my first 5 years. I did a bunch of curriculums, and I had my AGD fellowship and all this stuff early on. Great, and you should do that. These things are important. Like being an excellent clinician and being highly ethical, these things they're not negotiables, I think. But that does not mean you're going to be successful as a practice owner. Again, my personal testimony. You will still struggle unless you get a few things right on the business side. And these are things that we are not taught in dental school.
All right, so let me ask you, from when you graduated from dentistry, what were some of the biggest misconceptions you had about owning a dental practice?
Yeah, there were a few. And so one of them being what we just talked about, in that, well, I'm good at what I do, therefore people should come to me. Not so, they don't know you exist. Okay, so how do I deal with that? And now I have employees. Well, I've never had employees before. What do I do with employees? How do I manage them well? How do I get them to do what I need them to do? And it's the fact that I pay them enough to get them to do that thing. So you have this thought about, everyone has this dream when they go to dental school about what dentistry is going to be like. For me, it was like watching the dentists that I knew in the community, my own dentist. It seemed like it was a respected profession. They were good people. They were doing very well. It was a stable, sure thing, let's say. And I thought, okay, well, that looks like a good road. And so that is kind of the picture that I had going into dental school. Graduating from dental school, well, things were very different once you hit the pavement and actually start to figure out, well, wow, that's interesting. So that costs that much? Oh, and then you realize how much overhead is and how much you have to actually do beyond the clinical, which is now I'm spending whatever hours clinically a week, and now I'm trying to run my practice, and I'm spending probably just as many hours in the beginning because I have no idea what I'm doing, and trying to figure all these things out the hard way. There was no defined path, right? So you're just figuring stuff out. So these are the biggest challenges. We see this with startup practices. People will call us after they have committed to the space, designed, started construction, and they're like 2 months to opening, and okay, we realize now we don't know what we're doing. It's a little late,
I will tell you I've been at this now, I graduated in '84, so I'm now just over 41 years out. We have someone full-time sterilization. I have an office manager who is unbelievable, but does all my compliance stuff, everything to stay in bounds with government agencies. I don't imagine how anybody can start a practice from a standing still, just to be in compliant with everything.
Yeah, things have changed a lot. Now, it is possible, right? So I'll give you another example. I did an interview kind of like this, maybe 3-4 months ago, with one of our clients who did a startup, actually not far from here.
Yes, I remember.
Yeah, in Oakville. And his practice was extremely successful out of the gate, but he started working with us a year before he opened. And we figured out together the gaps. Now, he was not a brand new dentist, but still, if I'm going to open from scratch and I've never been a practice owner before, well, I need to understand leadership. I need to understand systems. I need to understand marketing. I need to understand who do I need to bring onto my team? What roles should we be filling? How can we juggle in the beginning when overhead is tight, when profits are tight? How do we make sure that we don't open and we have no patience? Like, all of these things take time to figure out, to dial in, to sort out in advance, so that when D-Day happens and we are open, there are actually people in the schedule.
You hit the ground running.
Yeah.
Interesting. Okay, it's no secret, and I'm not telling tales out of school. So let's talk about your personal health crisis change. And that was the impetus for you to just look at life differently, your dental practice differently, and that was kind of looking back, was actually a good thing for you because it really helped you grow immensely. So just talk to us a little bit about what happened and how it affected you.
Yeah, I call it the best and worst thing that happened to me. So 2012, our practice was good, was conventionally successful, as I call it. Everyone looking in would say, yeah, this is a good practice. You're doing well. You're doing, a couple $1 million a year. You have your dozen employees. You're making good money. From anyone else's perspective, it looked good. Like, this is where you should aspire to. It was that, unfortunately, it was that, that saying that, you spend all this time climbing a ladder only to realize you're on the wrong building. And at that point, I was like, okay, yeah, I get that we're making money, and yeah, I understand that the practice is successful, except I'm burned out and exhausted, and like I'm
pretty young in your
done.
career.
Yeah, like I'm expended here. And this was 13 years out of practice, or 2012. So it was 7 years.
3 years? Well, 2009 I have that you started.
Yeah, so I graduated in 2005.
Right.
Yeah, so it's, just a handful of years, 7 years out of school.
7 years out of school.
And I'm hitting the wall. And so we were on a vacation, my wife and I, because we were doing this kind of quarterly just to get out and decompress, scuba diving in the Cayman Islands, which I love. So first dive, I was like, seemed fine. Everything was fine. Dive computer was fine. I was a textbook dive, came up, and I wasn't quite right. By the end of that day, my wife says I sat on the couch and I stared at the wall in the condo for 3 hours. I don't remember it. So that night I went to the hospital, got checked in there, spent the rest of the next 9 hours in a decompression chamber, in a hyperbaric chamber, basically trying to put a stop to the damage that was being done. So I had a severe decompression injury. And everyone that I talked to said, you are like the luckiest person that we know, because you could have had nitrogen bubbles is what happens. It comes up into the blood. If it had landed, spinal column, you'd be paralyzed. If it landed here, you'd be dead. All these other things that like just explained to me kind of what was happening. And coming from a medical background, like I understood what they were talking about, and I realized like this is like, there's more to this. So anyway, took me, I don't know, good 6 months to get back on my feet, a year to be back to normal. And during that time, the thing that really stood out for me was, like, in the beginning, you're not worried about what's going to happen in my practice. I'm worried about survival, right? You get past that point, and then it's like, okay, yeah, the practice. How are we going to deal with that? There's no plan. I mean, you have insurance for disability and so forth, but there's no way you're going to be able to maintain a practice without it kind of tanking on you, right? So we got through some of that, and as we got into the months that followed, the thing that really stuck for me was, okay, if I'm going to go back to this, it has to be different. Right? If I don't fix the practice to where I want it to be, I'm going to quit dentistry, because it's not the only thing I can do. And so I spent all that time that I was off studying and learning everything I could about business, not just dentistry, but outside of it. In fact, it was entirely outside of dentistry. So I studied restaurants, I studied the hotel industry, I was in rooms, and the rooms I'm talking about, with business owners owning $100 million companies. And my big question to them was, more at the lunch table than anything else, how do you run your team? How do you operate with 150,000 employees? I find 12 difficult. Like, what is the gap? And then you realize it's actually not that they're smarter than you. They've just got some things figured out that you haven't yet. So to me, looking back at this was the key push for me to realize, okay, well, if I'm going to continue down this path, I need to fix this, because basically, this life is not what I want. I don't want to be burning both ends, killing myself, trying to make, whatever I think that this practice should look like. I want to be able to have free time. I want to have family, which we hadn't at that time. So to me, this was the push. And this is what pushed me into wanting to understand business at another level altogether from what I thought I knew. Yeah.
Good. So can you explain to me, and I think this, I noticed this in one of your literature, you had a beautiful visual of all the baseball hats.
Oh, yeah.
Okay? So can you please explain the 6 rules that dentists often play simultaneously, whether they know it or not, and which role is most challenging to delegate?
Yeah, good point. So this is on the cover of the leadership book, which was put out maybe a year ago. And so there's actually 5 hats on that cover, but there are really 6. So the dentist, okay, so if we just step back for a moment, back to a quote unquote real business, which I hate to say because the dental practice should be a real business. But if we look at the way a traditional company would run, you've got your CEO who's the quarterback, right? They're running the show, they're calling the play. But then the CEO has their C-suite. You have your financial person, you have your operations person, you have your marketing person, right? And you can go on and on and on. Well, you have your HR person, right? And they all work together to realize the vision of the CEO. Then you have the frontline workers who are making the widgets that are sold or the service that needs to be delivered. In a dental practice, it's very different. Well, it's basically a very tiny version of that where the dentist just keeps swapping hats and they're trying to do all of that. So I'm running my tail off all day treating patients, and then I'm trying to switch between that to have a lunch meeting with my team for an HR issue, and then I'm dealing with my accountant at between patients to deal with finances, and then I've got operational challenges that I'm trying to figure out during my day or in the evenings, and then marketing. Oh, who has time for marketing?
And then what I also realized, they're trying to do all these other jobs, and yet they haven't been properly trained.
Oh, yeah.
In any of these other jobs.
Yeah, great point, because in a typical business, the person you bring on as your CFO, this is a person who knows what they're doing.
Yeah, they're an accountant, they've got advanced degrees in finance, absolutely.
Yeah, and likewise in operations, this is someone who knows what they're doing. This isn't the first gig, they are experienced in that role. And likewise with HR, they're not asking elementary questions. They know the rules, they know the law, they know what they can and can't do, they know who they're looking for, they know how to screen an employee and so forth. If I'm just dabbling in all of these things, I'm doing none of them well. It's the jack of all trades, master of none, right? This is
correct
where you end up. Yet I really just, if you ask every dentist, they will tell you the same thing. If I could just treat patients and the rest could go away, I'd be happy. Okay. Well, that's great, because that can be done, but that's just not how we're running. Most practices don't run that way.
Okay, again, so I'm going to go off script for a moment. Based on what you're saying, is there still that dream to have your own practice, or are many of the young dentists today, you know what, I got a ton of debt from school, I'm just going to work for a big corp? Is there still that passion to have your own ship?
So I was asked this question actually fairly recently by another party that asked me just for what would you say to a dentist who was, looking at entrepreneurship versus being an associate? And it's exactly the same answer I'll give. So entrepreneurs are cut from a different cloth.
Correct.
Straight up, like you're either wired for it or you're not. Now you can learn, absolutely you can learn, but there's a spark, right, with a person who can be a business owner. They have the ability or maybe the desire to accept greater risk for greater return. They see it. Like they understand, I'm willing to risk a little if I can do asymmetrically better than punching my punch card and I make X. So they're cool with that. Another thing is that they're generally driven to push themselves. They want to see what the edge looks like. They want to, they're driven people. Those folks, building a practice is still going to be their dream. And we talk to them all the time. And there are those, however, that really I just want to work 3 days a week. I don't want any stress. I don't want any, to deal with staff, et cetera, et cetera. They're great associates. And the industry needs both.
Okay. All right. Along the same topic, just a little bit of a variation. So why do you believe that the traditional solo practice model is no longer sustainable in today's dental landscape? I know we touched on it a bit in the beginning, but I just would like you to elaborate.
Yeah, so I won't say it's unsustainable, but I will say it is struggling. And the reason being is kind of what I discussed earlier, what we talked about earlier, as you noted, in that there is this uncertainty that always is there. If I get sick, what happens? If anything happens to me, for that matter, what happens? So if I'm the typical dentist, me and my 4 team members, 5 team members, great, that's fine. But recognize what it is. You own a job. And that's okay. Like, it's not a judgment against the person who's doing that. It's just that this is where you are and you got to know that. Like, this is not a business. This is a job. And if you don't show up, you don't get paid. Straight up. No one's going to, yeah, hygiene may see patients. That's cool. But your overhead's going to eat all that up and then some. Fine. Just know what it is, right? So again, when we could take that a level up, because there are people in our program that will tell you, I can think of one off the top of my head who has been with us for maybe 5 years now. For the last year and a half has been off on health issues, personal issues, etc. And his practice is still running and he's still taking a paycheck. And he is a dentist. They have an associate now and they have hygiene running. But with the model and the systems and the team that they have, is profitable in his absence. That is not most practices, though it can be built. It's just
that's
intentional.
the goal.
That's right. That's exactly the goal. The goal is not to have, 17 operatories and 12,000 patients and all that stuff that we did in our practice. The goal is, what does it look like for you in the ideal case? And for most dentists, I just want assurance. I just want peace of mind. If something happens
Security.
to me, yeah, then what happens, right?
Okay, and just before we wrap up, I'd like you really to elaborate, because as we go through this videocast series, we're going to talk more about elite practice. So I'd like you, how did the concept of elite practice emerge from your own experience, and what sets it apart from the standard practice models?
So our program emerged from our practice, which is, I think, what sets it apart right there, is because there's no shortage of great ideas, right? Everyone understands kind of the basics of how do I run a company, or how should I be running my practice. The key is in actually making it happen. So in our practice, we got to a point where we were growing and growing and growing. Eventually we got to, as I mentioned, 17 chairs and 12,000 patients and 40 plus staff members, team members. Okay, so now with 40 plus team members, there is always a group of 7 or 8 people who are off on mat leave, who are coming and going in some capacity or another, and there is turnover. And turnover can be, you can go one of 2 ways, right? If you think of your favorite restaurant, you go there because the same people,
Consistency.
they know you, they know your table, they know what you like to eat, they know your order, right? If I show up to that restaurant now and those people are gone and it's all brand new people, they have like 1, maybe 2 chances to not blow it before I leave as a customer. The absence of consistency is what destroys companies. And this is the thing that we were having happen, right? So we have turnover, it's gonna happen. Everybody has turnover. But what happens when a new person comes in? First of all, how do I find the right person? Who am I looking for? Then when they come in, how do I make sure that the experience that my regular customer is used to getting, they will get, no matter who they see as a hygienist, as an example, or who they check in with or check out with at the front desk, or who they see as an associate dentist. If the consistency is there, changes everything. So we built this entire training process exactly to solve our problem. And then it became something that was scalable. Other dentists started asking, how are you doing what you're doing? We started sharing, and it became a thing that was, well, okay, you know what, this is actually portable. Let's test it. And eventually out of that, 10 years ago now, grew elite practice.
Okay. Thank you very much. I want to thank everybody for listening today. Be sure to subscribe to Brush Up's email alerts on Spotify and YouTube to be notified every time we post a new episode. And please remember to keep brushing up. Thank you, Dr. Biasucci.
Thanks, Jordan. Appreciate it.